outside of the room currently, and I'm getting on my PPE for contact precautions. So I'll do gown first. Alright, I have there.
We need a pin light.
I have one. Okay, continue the video. Sorry. So I verified my orders, checked my packaging and expiration dates. Okay. Knock, knock, knock.
Hi, come in.
Hello, my name is Maddie and I will be your nurse today, so I'm just going to get set up here really quickly. Alright, and then can you just verify your name and date of birth for me?
My name is Ivy Armstrong, March 9th, 1964.
Great, and that matches your armband. And do you have any allergies?
Yes, latex.
Okay, and that matches your armband. And then can you just tell me which hospital we're at?
Barnes Jewish.
Great, and then do you know why you're here?
Gastrointestinal issues.
Awesome. So I am here today to do a focused cardiac assessment, and then I'm just going to make a note that the lights are on and the curtains are closed. And then would you do me a favor and also tell me what year it is?
2025.
Okay, and what month it is?
February.
Great, and then what day of the month it is?
Thursday the 13th.
Perfect, and you know what better than I do. Alright, so I'm just going to raise you up to a little bit better height. So we're going to do a cardiac assessment, a GI assessment, so we'll check on your stomach issues a little bit, and then I'm going to be placing an NG tube before your surgery today, okay? Okay. Alright, Miss Ivy, so the first thing I'm going to do today is going to be a cardiac assessment. So if it's okay with you, I'm just going to unbutton your gown a little bit.
Yes.
Great. Alright. So I'm going to unbutton you really quick. Alright, and then I'm going to be listening for any murmurs, and we're going to do aortic, pulmonic, Erb's point, tricuspid, and mitral, and then everything sounds good there. No skin breakdown. Alright. And then, Miss Ivy, the next thing I'm going to be doing is a focused GI assessment. So I'm just going to be listening for your stomach sounds and then palpating. Is it alright if I lift up your gown?
Yes.
Great. So I'm going to start in the right lower quadrant with auscultation, and I'm doing for 1 minute on each quadrant. Okay, and I'm hearing 5 to 30 sounds per minute, so your vowel sounds are within normal range. And the next thing I'm going to do after that is I'm going to palpate. And I feel no masses. Did you feel any pain or tenderness?
No.
Okay, very good. Alright, so I have you covered back up. And the next thing I'm going to do is I'm going to raise raise you up to a 90-degree angle, and we're gonna start taking steps to get that NG tube in, okay?
Okay.
And I'm gonna move this pillow out behind you before it gets uncomfy. There we go. I'm going to move my car over here. Alright, so I'm going to lower the bed rail. Okay, I'm not going to lower the bed rail, but that's okay. And then I'm going to, typically I would change my gloves, but I'm not doing that. Alright, so the first thing I'm going to do, Miss Ivy, is get you kind of set up here. So I'm going to cover you with this towel. Have you had any nasal surgeries or reconstructive surgeries on your face at all?
No.
Okay, and do you have a deviated septum that you know about?
No.
Okay, great. And then the line is on the inside. Typically I should have that ready. Okay, so the first thing I'm going to do is I'm going to peek in your mouth. Everything looks fine in there. And then I'm going to look up your nose. Great, and it is not deviated. And then, can you blow out of your nostril?
Yes.
And then blow out of this nostril. And then, is there either nostril that feels like you're getting better airflow out of it?
My left one.
Perfect. Okay, so I will place your tube in your right nostril. So, if you'll just give me a moment, I'm going to get set up here. I'm going to give you some water.
Yeah, the other way around. This is just my own preference, but I like the way it's so that
Okay, so I'm just getting some tape set up here. Okay, Ivy, and this part is not fun, but I'm going to have to check your gag reflex really quickly.
What if I have to vomit?
And I am going to have a bucket set up for you, do not worry. Thanks, Ivy. Okay, so I have my bucket here. So I have you covered, and then if you need a vomit, just do ahead into the bucket. So I'm going to do this as quickly as possible. Okay, and we'll open up, and all right, perfect. Thank you, Miss Ivy. Okay. So the next thing we're going to do is we're going to place our NG tube, and I'm going to lubricate it really fast to help it go in.
no, I mean, you keep going up this one. You're not going to yeah, so I have to tell you. Yeah, if you're going to read it.
How do you know how much goes in me?
We'll have to measure it first. Okay, we're going to measure it. So we'll start here. And then we hit the earlobe. Down to the sternum. And then we're going to mark. Now I'm going to lubricate it. you tilt your head back towards the ceiling. And I'm gonna start inserting it on 3. 1, 2, 3. Keep going in. Alright, and then Ivy, I'm gonna have you tilt your head down, chin to chest. Great, thank you. And then you'll grab your water cup and we're gonna start sipping, and we're sip, 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 sip. Sipping. Okay, alright, that is in. There we go. And then are you having any pain?
No.
No pain? Okay. And then are you able to talk to me? Can you say a little something to me?
Yes, I can.
Okay, great. I'm so glad to hear that. So I'm going to temporarily take this here. Sorry, Ivy, it doesn't stick very well. Now, I'm just going to check to make sure we're in the stomach. In a good spot. So I'm going to pull out 5 milliliters. Great, and I have some gastric content. And then I'm going to check the pH of it. Okay, and that matches between 3 to 6. And then I'm just going to send you off to radiology to double check that that tube is in the right place. We're just going to take an image of it and make sure.
Okay.
And I'll get you cleaned up real quick. Alright, Ivy, welcome back. So that tube was in the right place, and now I'm going to permanently anchor it. So, great, and then my last piece of tape is going to go here. Great, okay. Now I have an order to connect it to intermittent suctioning. That was low grade. So, to do that, I'm going to go here. Okay, great. So I'm going to put it on continuous, and then we're going to go. Okay, and then we're switching to intermittent. Okay, perfect. So that is on, and that'll stay like that. And then Miss Ivy, I'm going to lower you back down and get you comfy, and we're going to go to a 30-degree angle. Alright, 30 degrees there. And then I'll put your pillow back down to your head. There you go, Ivy. Alright. You want your bed down?
Yes.
Alright, would you like the lights on or off?
On's fine.
Alright, I'll leave them on. And then I'm going to come back and check on you in about an hour. See how you're doing. Alright, I'm going to place your collar in your hand. Call me if you need anything. And is there anything else I can grab for you before I leave?
Nope.
Okay, great. You did awesome today, Ivy. Thank you so much. And then